The state of Indiana right now is dealing with a high number of respiratory illnesses. All of this coming as we head toward another holiday weekend where lots of people are going to be gathering in groups. Tonight, our Rachel Krause talked with doctors who tell us it's important for you to stay cautious.
We have a lot of respiratory virus season left. So go out and do those things and prevent it, because we don't know which direction these numbers are going to go.
Christmas holiday parties are in the past, but New Year's gatherings are now just days away. For many, masks and social distancing aren't top of mind. But doctors say with the rate of respiratory viruses staying high this winter, people need to be cautious.
Influenza is kind of the big dog for a lot of places and settings, causing a lot of issues. But COVID is rapidly catching up. We're on the up cycle, and the holidays, the last month or so, and continuing into next week are not going to help. We're going to continue to have competing respiratory viruses.
New COVID-19 cases shot up nationally after Thanksgiving, staying high. And data from the CDC shows more than 300 people are still dying every day from coronavirus in the U.S. Hospitalizations are on the rise around central Indiana and nationally, and many of the new cases involve seniors.
Age has been one of the strongest predictors of severe illness and death. There was always this continuum that the older you were, the more likely you were to get into trouble. And for a while, that was moderated because older people were more likely to be vaccinated. But now that older people are vaccinated but not boosted, and it's been a while, some of that protection has worn off.
Indiana has been lagging behind the U.S. in vaccinations. Just 55% of the state's total population got that initial vaccine series, and only 11% of the state is up to date. Dr. Amy Beth Kressel says those numbers are concerning.
We're not having the surges we had last year, but certainly a lot of people are still at risk. A lot of people are dying, more so than we would ever have considered acceptable 3 years ago. And there are countermeasures. They're the vaccines, antivirals, and masks. That is true for both influenza and COVID.
And as influenza and respiratory viruses packed a harder punch even earlier this winter, Tamiflu has been in short supply in some parts of the country. To help hospitals and pharmacies out, the Biden administration says it will release Tamiflu from the Strategic National Stockpile to states that ask for it.
There have been intermittent shortages of Tamiflu. At my hospital, there have been intermittent supply issues, but not enough to seriously impact patient care. We've always been able to get what we need eventually. I think the Biden administration's actions will help.
So we've got the holiday weekend coming up. Lots of people gathering for New Year's Eve and other holiday gatherings. What's the advice for people that want to participate?
Well, doctors say that this one might seem obvious, but if you do not feel well, please do not go out on New Year's Eve. And even if your COVID test is negative, you might still have an upper respiratory infection, or you might have the influenza, and you could still get that sick and you could still spread that to others. And of course, if you've got high-risk loved ones, or if you're going to be going out into a big crowd for New Year's Eve, consider masking up and catch up on those flu shots and COVID-19 boosters. Even if you get sick, they can help to keep you out of the hospital.
Yeah, good advice, Rachel. Rachel Krause, thanks so much.